In 1985, 7 years after the birth of Louise Brown, ESHRE was founded by a small group of experts in reproductive medicine led by scientists Jean Cohen and Robert Edwards. The birth of Louise Brown was the inspiration for the ESHRE Foundation. At a time when assisted reproduction came out of the shadows and into mainstream medicine. ESHRE's IVF progress throughout the 80s was rapid and far-reaching. The introduction of improved ovarian stimulation and the use of ultrasound follicle puncture, developed in Copenhagen, made the IVF procedure much easier. In 1992, intracytoplasmic sperm injection by a group of experts at VUB in Brussels was a major breakthrough to overcome male infertility. The ability to freeze and subsequently thaw and transfer embryos, as shown in Rotterdam and Melbourne, significantly improved the feasibility of IVF. Now it became possible to screen the embryos of individual couples at high risk of having a baby with an inherited sex-linked or monogenic disease. Skills in micro-handling were also behind the first live birth in London following pre-implantation genetic diagnosis. In 1995, Human Reproduction Update was introduced and is today's leading ESHRE journal in reproductive biology and obstetrics and gynecology. And in taking stock of the past, we can glance ahead to the new vision of ESHRE's future: the legislative harmonization of Europe, cross-border care, and the implementation of good ethical clinical practice across Europe to the highest standards for all patients. ESHRE has remained firmly attached to the principle of single embryo transfer to reduce the risks related to multiple pregnancies, as well as their long-lasting consequences. The challenges facing ESHRE today are political issues, public affairs, good clinical practice, and the impact of scientific progress on everyday life. ESHRE has been keen on joining all the debates openly. Now, 31 years after the birth of Louise Brown, ESHRE steps out into a new decade, still embodying the same visions as 25 years ago. ESHRE, science moving people, people moving science.